Hi, I'm Dr. Jonathan Craighead, and this is a short video to make sure you're prepared for your upcoming hip replacement surgery. By now, hopefully you've gotten your walker and had your pre-operative physical therapy appointment. It is important that you bring your walker with you on the day of the procedure. If you do not have your walker and have not had your physical therapy appointment, please contact our office immediately. The Jefferson City Medical Group Surgery Center will be contacting you the day before your surgery to give you your arrival time. Typically, you'll be asked to arrive approximately 90 minutes before your surgery. The surgery itself takes about an hour, and typically you're in the recovery room for 1 to 3 hours afterwards. We've sent the post-operative prescriptions to the pharmacy of your choice. Please pick them up and have them prior to the surgery. You do not need to bring them with you on the day of the surgery. If you are on blood thinners, you will need to stop them ahead of time. If you're on Plavix or Coumadin, please stop them at least 5 days prior to your surgery. If you're on Eliquis or Xarelto, you need to stop them at least 3 days prior to your surgery. Also, please make sure that you have your house prepared. Remove any clutter, loose throw rugs, or cords that you could potentially trip on. You should not eat anything 8 hours prior to your surgery. You may drink some liquids up until 2 hours prior to your arrival. Approved liquids include water, tea, black coffee, apple juice, cranberry juice, Gatorade, Powerade, and grape juice. If you drink tea or coffee, it should be black and there should be no cream products in it. Ensure makes a pre-surgical drink that you may take up into 2 hours prior to arrival. It's available at most pharmacies. If you do not want to use Ensure, Gatorade or Powerade work well also. You should not drink any milk products, orange juice, grapefruit juice, tomato juice, alcoholic beverages, or carbonated beverages within 8 hours of your surgery. The morning of your surgery, you may take your normal medication with a sip of water. We would ask that you withhold any blood pressure medications and especially do not take any ACE inhibitors. Please don't take enalapril, captopril, or lisinopril. The night before your surgery and the morning of the surgery, we would ask that you take a shower and please scrub your hip with an antibacterial soap. Please do not shave within 48 hours of the surgery. If you have any cuts, sores, or scratches, or any evidence of infection, please contact us immediately. Once again, it's important to us that you feel safe and comfortable throughout this process. If you have any questions or concerns, please do not hesitate to contact us.